Good evening, everyone. Let's start with our everyday unknown class. So far, we completed up to aphorism 26. Just giving you an overview as today we are going to discuss aphorism 27, 28, and aphorism 29. So far, what we have completed, we started with aphorism 22 regarding the what is the therapeutic law. 22 to 26, we came to know about which is the therapeutic law going to remove the disease rapidly, readily, and permanently. We came to know it is of similar. And now, what is the law? What is the therapeutic law we came to know? How does it work? In these three aphorisms, aphorism 27, aphorism 28, and aphorism 29, Henman is going to teach us as per the knowledge of Dr. Henman up to his time. He is going to tell us how it is going to cure, how law of similia, how this homeopathic therapeutic law cures. When you discuss how of anything, how means you're discussing the science of it. And here in these three aphorisms, Hanwin is going to discuss how the science of therapeutic law, homeopathic therapeutic law, is as per the clinical experience. It is as per the outside understanding. It is not the laboratory work. It is the clinical work. It is the understanding at the bedside. And now when science has developed up to so much, the onus is on us to extend this science, how this law of similia cures. So first let us understand regarding what Henman wants to teach us. To start with, let us go ahead with aphorism number 28. What 28 is teaching us? Sorry, 27 is teaching us. So this 27 says, again, mind it, this 27 aphorism is having A, means there is a reference to appendix in relation to this aphorism. And in the appendix, it just says one thing, that this aphorism from 27 to 35, they appeared in the second edition onwards of the Agrawal. This very aphorism was not there in the first edition. This complete block 27 to 35. So let us start with the aphorism. The curative power of medicines, therefore, depends on their symptoms similar to the disease but superior to it in strength. One very important thing, 2 points to keep in the mind. First, we got to know that what medicines produce in the healthy human being, they are potentially able to cure in a individual suffering with those kind of symptoms. This is a simple understanding. The disease producing power, sign and symptoms producing power is the curative power of the medicine. This we understood earlier. Now, point is that when you apply, are you applying it with the right similarity, with the apt similarity, with the most similar symptoms to the disease? That is a very important question. We all face such kind of difficulties in our clinical practice. Though we sometimes feel in a case that we have selected the right medicine, but when the result comes, sometimes we find that it did not work, and we were able to later on find out that the difficulty was that our judgment was wrong. So, the effectiveness of the law of similia and of the medicine, which is whether it is homeopathic to the case, whether it is really similar to the case or not, that is was one very important thing. Then the other thing is the first is the similarity of the symptoms. Second is about the strength of the medicine. These are the two very important points. I read you again, you will be able to get it. The curative power of medicines therefore depends on their symptoms similar to the disease but superior to it in strength. So, similarity depends on two things. One, the similar symptoms and the dose of it, the potential, strength. And how this is been very well explained in Aphorism 12 to 26. We can read them again. Almost every place Henman spoke in respect of the medicine that only similar symptoms are not enough. The right strength is also important. That potency is also important. So one point is this. The curative power of the medicine depends on the 2 points. One, how much similar symptoms it has with the symptoms of the disease. And the potency, the strength, which should be superior, is somewhat higher, which has been very well explained in the Aphorism 12 to 26. That is why he has referred here that if we forgotten, read these aphorisms again. So that each individual case of disease is most surely, radically, rapidly, and permanently annihilated. 4 points. If you are able to give somebody a medicine which will be called curative only in 2 conditions, when it is most similar to the symptoms of the disease and it is superior in the strength, then what is going to happen? Disease is going away. And in like this 4 words: rapidly, readily, most surely, readily, rapidly, and permanently annihilated and removed only by a medicine capable of producing in the most similar and complete manner. In the bracket says in the human system. Again, he is a kind of repetition, reminding us that all these symptoms must be seen in the proving and complete manner, the totality of its symptoms, which at the same time are stronger than the disease. why and how it is stronger, we will be learning in the following aphorisms from 30 onwards. So, how it is to be cured? How does it cure? For that, he is first talking about that when a medicine will be called curative. This is very important for us for a clinical purpose also, for the bedside also. Symptoms must be similar, but what are those symptoms? Which symptoms you have selected? He says those symptoms which are seen in proving. You cannot ignore proving and just take all the time some other symptoms and use them. Proving symptoms are given much more importance. Nowadays, what is happening that we are far away from the proving symptoms. Even we do not know what are the proving symptoms of each drug because we are not directly reading the provings. We are reading the certain experiences of various stalwarts after Henman. No doubt, it must be studied. It is always good to learn. But then Ognon teaches, Henman urges us that we must be reading provings, and those symptoms are the most trustworthy symptoms. That is why there are two kind of repertories you will find, that those repertories which are of the Bonigoson Boger category, they are keeping foot down for the proving symptoms. But then repertories which were built upon further on Kent repertory, they contain lot of many other symptoms cannot be equated with the proving symptoms. Even having clinically proven symptoms is all right. But then what criteria for the clinically proven symptom is taken? No such details are available. Sometimes some very fragmentary provings, sometimes some very doubtful symptoms in the proving also added. Sometimes some doubtful provings are being considered, and it is almost like a garbage in those repertories, and it created lot of difficulties and lot of failures. Why? Because we are not seeing these aphorisms, especially this aphorism which is teaching us that how the proving symptom is given the importance. I read the aphorism again together. The curative power of medicines, therefore, depends on their symptoms similar to the disease but superior to it in strength, so that each individual case of disease is most surely, readily, radically, rapidly, and permanently annihilated and removed only by a medicine. See the word only by a medicine capable of producing in human system in the most similar and complete manner the totality of its symptoms, which at the same time are stronger than the disease. So we are to match the similarity of the symptoms, and that similarity must be similar not only in the symptom but in the intensity of the symptoms, and at the same time the strength of the medicine, that is the potency of the medicine, is important. So this matching in this aphorism he is teaching us, Like for example, we all read Epicac. We know Epicac is a medicine for nausea. But the right word is, which we generally ignore or get shadowed, that is constant. Ipecac is for constant nausea. Nausea, we have so many medicines. But then when you say constant nausea all the time, vomiting is not very important in Ipecac. It is the constantness of the nausea which is important. So this intensity must be matching with the similarity of the symptoms and then the potency. So these are the three very important things he mentioned, which is responsible for the curativeness of a given medicine. We somehow match symptom but unable to match the intensity of the symptom in the medicine and in the patient. If we are able to match the symptom and the intensity, we are unable to match the potency of it. But the most often the difficulty occurs is regarding the intensity of the symptom. The most important beauty of the Kolkata school of prescribing is matching the not only symptom but the intensity of the symptom. Reading Allen's keynote, we have three kind of gradings: the bold one, the italic one, the ordinary one. It is nothing but to teach us the intensity of the symptom and to learn in each patient that in which intensity the symptom is present. We have to match both. Calcutta school teaches this very matching of intensity also. That is something very, very important which Calcutta school is teaching, which is being ignored by many, many different other schools. This is not given the due regard and importance. But this aphorism is very much, very, very clear to make us understand that the curativeness of the medicine depends mainly on three things. One, the similarity of the symptoms. Second, the intensity of the symptoms. And third, the potency of the medicine. So this is first very important thing he mentioned. See, what is Hahnemann is talking is all about the bedside understanding of how does a similar medicine cure, how the homeopathic therapeutic law cures. One thing he explained. Then in this aphorism, there is no such footnote given. And if we see the 27th aphorism in the table of content, what is it saying? In the table of content, aphorism 27 says the curative power of medicines therefore depends on the symptoms they have similar to the disease. Very simply, he mentioned. But then, if we see in the aphorism, we get these three things: the similarity with the symptom, similarity of the intensity of the symptom in the medicine and in the patient. And the third thing is the potency of the medicine, the strength of the medicine. These three things matching is important. If we fail in matching these 3 points, definitely the this very effect rapidly, radically, permanently cure takes place, we may not see. Now going further to the next aphorism. Now another point comes regarding the intensity of the symptom. Why we miss? First of all, we do not give due regard to the intensity. All symptoms have got intensity. When you are studying practice of medicine, they also talk intensity. When they say breathlessness, grade 1, grade 2, grade 3, grade 4, are they not talking about intensity? They are, yes. They have their own way to talk about intensity. Then, patient coming to you and very nicely talking, very smiling every way, very nice, sitting comfortable every way, and says that I'm a patient of asthma, I have breathlessness. And the patient comes and you only watch. What happened? Why are you so breathless? Are you not able to judge the intensity? Is it so difficult? Intensity of the symptom is just by the observation you can make out. Observation is the main key. You can easily make out. Not that a very big or some very special task judging the intensity. No, only that you be cautious about it. That symptom is a symptom along with its intensity. Somebody coming saying, I've got a pain abdomen, and talking to you smilingly, very pleasingly every way. And somebody coming and both hands on the abdomen and crying. Do you need to ask what's happening? You get it. There is a some severe trouble in the abdomen. When you say intensity of the symptom, its simple meaning is the level of severity of the symptom. If you can't understand the word intensity, understand this, that what level of severity the symptom is present in the patient in the diseased condition. And at the same time, you are to judge in the provings that in what intensity, in what severity the very symptom appeared in the provers. So be careful about the intensity. Now, going further to the aphorism 28. As this natural law of cure manifests itself in every pure experiment and every true observation in the world, the fact is consequently established. It matters little what may be scientific explanation of how it takes place. And I do not attach much importance to the attempts made to explain it. But the following view seems to command itself as the most probable one, as is founded on premises derived from experience. So let us understand this. As this natural law of cure manifests itself in every pure experiment and every true observation in the world. Now, regarding this natural law, since we call it natural law, it means it is all the time observable in the nature. All the time you can experiment and experience in the nature. It is all along present, does not require much of the explanations. Or at the best, we got so many examples in the footnote of Aphorism 26. Even in the warfare, they utilize the service of similarity to boost, to encourage their army personnel, and many places they're utilizing this law of similia. Hellman is utilizing it in the art of medicine, in the art of healing. Why? Because he says it is so evidently clear to see, all the time is seen in the nature, but then still, if you want, you can experiment it. You may not be trusting that law of civilia work. A person who want to investigate that with the homeopathic medicine, it helps readily, rapidly, everything. The one may sit with some homeopathic doctor and see the changes, see the miracle. Every student, means every one of us, include myself also, when we entered in the medical college, homeopathic medical college, are we not in the similar kind of psychological situations, whether all this work? But by the time we all experienced such kind of changes, such kind of improvement with the homeopathic medicine in so many of the cases, all acute, all chronic cases. Now we all are convinced. The same thing he is saying in this aphorism, that it is so evidently seen all the time in the nature. At the best, you can judge the bedside experiences. It works. And because it is so evidently that, but still keeping myself up to the bedside, let me explain in the next aphorism. This is what he's saying in this aphorism 28. Just read this again. As this natural law of cure manifests itself, manifest means that it exhibits, it shows, it is seen, it is exhibited. This natural law of cure is shown itself in every pure experiment and every true observation in the world. Means you check in any of the affair of the world. When one is extinguished, one force is extinguished, somewhere this natural law of cure works. The fact is consequently established. The very fact that this is a curative law is established. It matters little what may be scientific explanation of how it takes place. Since anything is very naturally established, something which is in every walk of nature exhibited, manifested, does not require much of the scientific explanations. Like, for example, we all at least once use the mirror. After bath, everything, we just comb hair and everything, we use the mirror. Now, all respected ladies, I would ask you that when you are wearing bangles in the hand, in the wrist, do you just see it directly, or even that bangles you also see in the mirror? I have never seen any of the ladies. It is called in Hindi, Hath Kangan ko arsi kya. Seeing the bangle in the hand, you do not require a mirror. It is a similar kind of situation. You don't require so much of scientific explanations, that whatever is very well explained in the nature, exhibited in the nature, you are to prove it through the laboratory. It's too much. It's not really that very important. That is why Henman says that every true observation in the world, the fact is consequently established. It matters little what may be scientific explanation of how it takes place. The scientific explanation to this matters little, but and I do not attach much importance to the attempts made to explain it. Command itself as the most probable one, as is founded on premises derived from experience. So, what in the next aphorism he is going to explain is something enough to explain the scientificity of it, and it is the most probable scientific. If you read in the modern physics, probability itself is a science. You do not understand the word probability just with one literal meaning. Probability is a word of mathematics. Probability is a word of physics. The probability itself is a principle now, according to the modern physics. Don't hear something, a idea of guesswork. It is not that. But then, whatever his explanation coming in the next aphorism, he says that I stick to the premise. When you the premise is a word of philosophy. The premise is you understand that your home, the area in your home is your premise. Now, in philosophy, when you're talking about one idea, that is a premise, and then premise is bedside. So, out of the bedside experience, Henman says, I am giving these probable explanations in the next aphorism. It may serve the purpose of so many oftenly asked this question that what is the scientific explanations? The difficulty is those who are too much of scientific mind, they agree that your medicine helped, your medicine cured me. But until and unless you tell me that how it works, until and unless you tell me what is the science behind, I will not agree to homeopathy. This is the sick scientific mind. Why I am saying sick? Because those who are very innocent scientific mind, they respect the phenomena. Even when the phenomena, how it is occurring, that the science behind it is not known, they do not reject the phenomena. This is the innocence of the science. Science never reject the phenomena. Science only asks that how it is taking place. So if even now so much of explanation not really available as per the scientific people, but the patients, those who are getting all right, they are not after this scientificity because they're simple, innocent people. They want to be all right, go to home, go to work, and they want to enjoy their life with their family. But so many of the scientific institutions are now after this phenomena of homeopathy. And so much of explanations are available and so much still to be sought of. It will come. But my point of view to myself, to all of you listening me, we all are clinicians. We know this phenomena every day taking place. If every one of us seeing some 10, 20, 30, 50 patients a day or more, and we see so many changes coming in most of the patients of ours. And when this is all happening, why should we unnecessarily bother ourselves? But definitely mind it, the scientists are now at the job to find the how as per today's knowledge. And him explained as per his time, as per his premise, that is, as per his Premise means the bedside experience. He's explaining it in the next aphorism as per his he's just explaining the whole phenomena, giving the science of it as per bedside experience. What is that? We all need to understand what exactly he is explaining, the how this law of similia work, how this similar medicine cure, how this cure take place. He is giving the explanation in aphorism 29. If you see this aphorism 29, this aphorism 29 is this appeared first time in the 4th edition, and if you compare the aphorism 29 5th edition, the 6th edition, some changes in the 5th edition. It is almost one sentence, and most of the sentence is in italics only. But if you see the 6th edition, Henman made the changes. He put it from italic to the ordinary, and he made it smaller sentence, not that one sentence. So if we just want to understand exactly what are the premises, I just made you just a simplification of this aphorism, and then we can read it later. This aphorism contains one footnote also. Can you hear me well? There's something wrong with my internet, I think. Hearing me? All of you? Just please, okay, good enough, fine. So, if you see this aphorism 29, which appeared first time in the 4th edition, if you simplify the whole explanation of how does it cure, how this law of similia cure, he says that in 4 points. What are those 4 points? Very simple 4 points. One, the first point is, first of all, he's explaining that we are talking about the dynamic disease. When we say disease, means the dynamic disease. Any disease occurring because of the surgical reason, means for example, accident and all, is not taking it as the main domain of homeopathy. So he explains any disease which is not strictly a surgical case. So any disease consists solely of a specific dynamic disease, mistunement of our life force. So what exactly he's saying in the first point, we understand that what is disease? It is the dynamic derangement of the vital force. It is the dynamic derangement of vital principle expressing itself simultaneously in the form of signs and symptoms which we all can observe by our senses. 1 point. See, you will find some 4 points, and all the 4 points are coming directly from the bedside. Because as such, you imagine the scenario of Henman's time, that is the 19th century, early 19th century. When I say 19th century, means 1801 onwards. So the first half of 19th century in which Henman worked. He went off this world 1843. So in this some period of 42 years, in this period, what kind of laboratories were available? You can imagine. It is only the bedside. So he says, according to his premise, that is bedside, his experience, he says the diseases are nothing but derangement of the vital force which express itself simultaneously in the form of signs and symptoms. We know this one. Second point is the life principle, which has been dynamically mistuned by the natural disease, is seized during homeopathic cure by the similar yet somewhat stronger artificial disease affection, which results from the application of medicinal potence selected exactly according to the symptom similarity. Now, you are knowing that we are knowing the derangement of the vital force by sign and symptoms. On seeing these sign and symptoms, you are finding a remedy which is most similar to the symptoms and the intensity of the symptoms and in a required potency. As soon as you give such medicine to this patient, what kind of activity it is going to cause? It is going to produce a condition where immediately the natural disease get seized. It just stopped there. And next point, what happens? Third point, the feeling of the natural dynamic disease affection is extinguished and disappears for the vital force, and from then on no longer exists for the life principle, but is occupied solely by the stronger artificial disease affection. When this similar disease, and we understand that one is going to exist on the very platform of life